Yes, what is welcome back. This is Gaurav AGY. Welcome to another podcast. I know ये podcast बहुत दिनों बाद आ रहा है, but to be honest बहुत कुछ चल रहा है लाइफ में, बहुत कुछ personal problems उस वजह से बहुत डिले हो गया है. But no need, don't need to talk about it right now. So आज के podcast में we have Dr. Pritisha Saxena, जो एक psychiatrist and 5 years of MBBS experience है उनके पास. So let's get into it. Let's get started.
So guys, let's welcome Miss Pritisha Saxena ma'am. Thank you so much first of all for giving us the time, and I know that the podcast is too much delayed, guys. I know. All right. So before starting, we would have a brief introduction about her. So Dr. Pritisha Saxena is a psychiatrist with over 5 years of experience leading in mental health at Vijaya Clinics and Nagpur, basically. So आज we are gonna get a free session for mental health, guys. So कैसे आप अपने mental health को like manage कर सकते हो, और how could you get it strong, or how you could do that. Just kidding. Gonna be a great session, guys. So make sure to tune in to the last. So let's start. So first of all, ma'am, क्या चल रहा है? How is going on?
Everything is really great, and just working, being consistent to make it more greater. And thank you
great,
so
ma'am.
much for having me
So-
on this podcast. Yeah.
Oh, that's your pleasure, ma'am, that you joined us today. That's great. Okay, so let's begin, guys. So, moving on to the first question, as of you have started this at the very young age, could you share some of what inspired you, or what sparked your interest in brain and behavioral science at 12, at the age of 12?
It was more about curiosity, because of certain things that I came across, and I don't specifically remember where, maybe all over the place, and it was something I was maybe looking for something interesting, and I've always had that, ki I used to love reading about some mysteries or some unresolved cases of anything. So that was always there. So I loved mystery, and then I came across neuroscience, brain, psychology, and how it plays a role in our human lives, and how a little difference in the brain anatomy, structure, physiology, chemistry, and of course your personal experience can shape it. So just like each fingerprint, everybody's brain is completely unique. It's because of our experiences, our perception. And when I understood this at a very superficial level, I was just intrigued. I remember watching that picture, I think it was in our textbooks, the iceberg, right? And that the conscious mind is just the tip of the iceberg, and the entire thing beneath that is your subconscious mind, which you can't really control. Like, people like us can't do that. Probably people who meditate a lot, the monks, sannyasis, and all those people who have tremendous, practice of meditation, I think only they might be able to reach up to that level. But this was really intriguing, and at that point I was like, "Nahi, maybe I need to know more further about this." And being in a very typical Indian household, I was told that because I'm not good at maths, I should be doing MBBS. So एकदम it was like a given कि भाई नहीं आता ना, इसको मैथ्स थोड़ी कर सकती है, ये तो अपन बायोलॉजी तो कर ही लेगी, तो MBBS करती. So that was the whole game. I went in, and I had these two options in mind कि एक तो forensic करेंगे, because that was also some interest that I had. To see, forensic was a completely different game altogether, where you are learning from a corpse, and you are trying to estimate their life. Even there's something called as forensic psychology, where psychology and forensic science come together, and that's also a very different, very interesting field. So these were the two fields, and I had a lot of backlash from mostly all my family members, all the elders, seniors that I used to meet. कि psychiatry तो मत कर भाई, it's a dead end. एंड कोई नहीं आता साइकियाट्रिस्ट के पास, और तेरे पास तो पेशेंट ही नहीं रहेंगे, और क्या पागलों के साथ रहेगी, एंड यू नो you'll also get crazy and all that. Very very typical thing that I think every psychology या psychiatry वाले जो भी aspirants होते हैं, they hear these things very 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 occasionally, very casually. People would be telling you this. So but still I was interested and I was like कि नहीं भाई, I want to do this because uh, it helps me to understand why the brain is doing what the brain is doing and what it might do, and how we can by doing certain things in a very systematic yet comprehensive way, how we can make it better. So I thought that this is the best where I want to go in. So that's, I think, what inspired me in a way, and there are other more inspirations, but आज के लिए ये inspiration.
Okay, so as you said, like maths नहीं आता इसलिए bio ले लिया. Same here, guys. I have taken like this. मेरे को bio में interest नहीं था, मैंने maths ले लिया, इसलिए मैं engineering कर रहा हूँ. And उसके बाद यही चलने वाला podcast और YouTube पे ये हमारा next goal होने वाला है, guys. Just kidding. Okay, that's great. To be honest, because actual like इतना सब सोचना, like हमें तो कुछ इतना याद भी नहीं था. To be honest, I am just 17 and 12वें साल I was like मुझे याद भी नहीं था मैं क्या कर रहा था. To be honest, again.
Yeah, but वही था ना कि मतलब see, you're doing this podcast now because this is what you like to do and you are interested to learn about people's life and you want to share that. And मेरे केस में ऐसा हो गया कि तब तक के तो समझ में भी नहीं आ रहा था, बस एक दिमाग में एक ही चीज बैठी हुई थी. एंड ऑनेस्टली आफ्टर आई गॉट इनटू साइकाइट्री, मेरे को तो सिर्फ 5% भी नहीं पता था अबाउट साइकाइट्री और साइकोलॉजी. एंड आई यूज्ड टू थिंक दैट आई नो, बिकॉज हर कोई जिसने साइकोलॉजी का थोड़ा बहुत पढ़ा है उसको पता लगता है कि मेरे को, मैं तोपचंद बन गया हूँ अभी. आई नो साइकोलॉजी, आई कैन डू काउंसलिंग, बट after getting into residency, then I understood. और अभी practice में भी I see these amazing people with some problems, some issues जिसके वजह से उनको बहुत ही hamper हो रहा है daily life functioning में. And when we are able to change that, treat it, make their life better, make their life what would be less stressful for them. So that was the thing. तो I think वही सेम ही चीज हो गई कि अल्टीमेटली अपने को पता था कि this is something that would make us feel good and feel like having a purpose. तो ठीक है, तब तो confusion सबको ही रहता है, बस लगे रहो. I think if that's the only thing, लगे रहो, be consistent and things will happen.
Yeah. So in short, guys, basically consistency is the key. Yes. Okay. So right now at Vijaya Clinics, you are dealing with mental health and the skin problems. So these are both at the two ends and like दोनों अलग-अलग aspects हैं. So how you think collaborating with them and वो कैसे एक दूसरे के साथ जुड़े and how you got it?
So basically, my husband is a dermat and I'm a psychiatrist. So because he's a dermat, it was already a skin clinic, and then I got in as a psychiatrist. Meanwhile, I also learned certain cosmetic procedures, certain clinical procedures that are done in skin as well. So that was also something that helped me, because in psychiatry I don't have a need to wear gloves, I can't use any instruments, I can't do procedures as such. But that gave me the satisfaction of being that as well, because I love to I used to love doing such things even back in UG or when I was working. So it helps me to give that touch as well, that okay, I can do this other stuff as well, where I can give a stitch to somebody, or maybe clean a wound sort of a thing, or work with other stuff which is done a lot in clinical dermatology. So I got to learn that as well, and I can assist my husband as well for that whenever it is needed. And when talking about psychiatry and dermatology, how it meets at where does it meet? It actually meets. There are certain conditions which do happen because of involvement of a psychiatric issue and a skin issue as well. So a very common thing most people must have heard about, psoriasis. सोरियासिस का मेन कॉज इज स्ट्रेस, कि अगर जिसको भी सोरियासिस है उसका स्ट्रेस बढ़ता है तो उसका सोरियासिस भी बढ़ जाता है, एंड सोरियासिस हैज नो क्योर। तो उनको भी यही बताया जाता है दैट यू हैव टू लर्न स्ट्रेस मैनेजमेंट टेक्निक्स, you have to keep a check on your anxiety if you're having any low mood, और उनको कुछ तो भी अगर बहुत ज़्यादा उनको परेशानी है सो साइकाइट्रिक रेफरल भी उनका होता है. So it's important in that aspect as well. And then there are certain interesting conditions but very horrible for the patient. One where a person might feel that there are insects crawling on their skin, and they would come to a skin or a dermatologist, and they would show that, see, there are insects on my skin, and they would just pick out some skin and they would show it ki, see, this is the insect, but that's not the insect, that's a tactile hallucination that they have, and it makes their life really worse because they feel all the time that something is crawling, maybe under the skin, over the skin. Then there can also be where they feel that the hair in their scalp is getting through their skull and touching their brain and tingling the brain. So again, a type of tactile hallucination that they are having, or a delusion that they are having. So this particular disorder is called as delusional parasitosis. People might feel that there are insects crawling on them. Then there is also a disorder where people eat their hair. They pluck it out and eat it. That can be seen in OCD. So there are such conditions, and very very common where hair fall due to stress. I think वो तो सबका ही होता है कहीं ना कभी. जब especially if you are a student, you are giving exams, there's going to be hair fall. Absolutely hair fall. So अगर कोई हेयर फॉल का पेशेंट डर्मेट के पास आता है, सो उनका ये भी थोड़ा दे आस्क अबाउट द बेसिक हिस्ट्री, दैट स्ट्रेस लेवल्स है क्या, आर यू स्लीपिंग वेल, आर यू ईटिंग वेल, और अगर ये एरियाज में गड़बड़ है, दे वुड हेल्प with some lifestyle changes. If they are not able to do lifestyle changes, then they would be referred to a psychologist or a psychiatrist to help them better with their routine and lifestyle and all those things. तो इस टाइप से इंटीग्रेशन हो जाता है ऑफ स्किन एंड मेंटल हेल्थ, and we get to save money on the space. That's why we work together.
Okay. Okay. So as you mentioned stress, so it's like कौन से common problems और जो like you have faced many patients till now. So what are the main common problems that patients deal with? या फिर कौन सा ऐसा stress होता है? One would be a financial one, maybe like personal and some. So how do you deal with them? What are the common ones?
See, the common ones are childhood abuse, childhood neglect. Then the common is having a lot of societal parental stress of performing well in school and academics, of giving a very competitive exam, be it NEET, be it JEE, be it for courses abroad. So every parent wants their child to do something. So majorly अगर मैं broad sense में बोलूँ तो childhood problems or problems from home, या जो केयर गिवर्स है बच्चों के, गार्डियंस हैं, उनसे जो प्रॉब्लम आ रही है. सो मोस्टली पीपल हैव दैट प्रेशर. वो एज खत्म होने के बाद फिर आ जाती है शादी का प्रेशर, दैट यू नीड टू हैव अ गुड जॉब एंड यू हैव टू गेट मैरिड एंड देन यू हैव टू हैव किड्स. तो दीज आर very common problems which have different level of like different scale of stress that they bring in for the person. Kyunki for somebody who wants to study and their parents are motivating them to study and they are giving them resources and everything, वो तो खुश है. पर जिसको पढ़ाई नहीं करनी है या जिसको पढ़ाई करने में दिक्कत आती है, there can be certain learning disorders, there can be underlying ADHD, there can be autism. Agar it is not diagnosed or it is on the spectrum is at a lower end, yeah, there is ignorance from the parents, which could also be like childhood neglect बोलेंगे हम उसको भी. तो these are like the common problems जो routinely मुझे दिखते हैं, routinely इन पे काम करना पड़ता है. So there's a lot of trauma healing that has to be done when it comes to mental health issues. So there's this new series on Netflix called as Monsters. I think if people haven't seen it, they should see it because it's about two brothers who kill their parents very brutally. And these two boys, they say that they were abused sexually when they were kids, and they were humiliated in front of public on a lot of times. But the defense says that they are psychopaths. So this case is ongoing, and it's a great um, docu series sort of a thing where you can see how things go. Even for a person who's having a personality disorder, if we say that they are a psychopath, it has to have some reason. Psychopaths are not born out of nowhere. So if these people are psychopaths, some sort of abuse might have led to being psychopaths, and mostly there can be a genetic association with it or some sort of traumatic history, be it from parents, be it from environment or anything, but there usually is. So nothing goes without some sort of trauma.
Okay, just click I got now. Have you heard about Jam Saul near Nagpur and the Solsar one?
I have.
So basically, some people there's a myth or I don't know what the real one. So वहाँ पे कहते हैं like pagals को cure किया जाता है और etc things. So what's
Okay.
that?
I'm not sure. It's, I think, a Hanuman Mandir, and
Yeah, that's
I
a
mean,
one.
yeah. So I'm not sure exactly what it is. I know Jam Sauli where it is, and there's a Hanuman Mandir. And if people are getting cured, so you'll get so many people who give such cures for mental health issues, thinking that it is a type of what do you say? आई मीन्स आत्मा आ गई है टाइप किसी के अंदर, कोई किसी ने झाड़ फूक कर दिया है, ब्लैक मैजिक किया है, इस टाइप की चीजें लोगों को लगती है. एंड आई वुड नॉट से दैट दीज थिंग्स डोंट एग्जिस्ट. I don't know if they do or they don't, so I can't comment on it. And when it comes to mental health, I think people should do what they believe in, because that is a very very important thing. I think if you're doing झाड़ फूक, कर लो झाड़ फूक, कोई प्रॉब्लम नहीं है, but also please try medical things as well. मतलब सब कुछ करके देखो what is working out for you, and of course be cautious about your resources and money. But I believe कि a person will, for example, if you come to me and you don't like me as a doctor, you would not feel satisfied with the treatment. But yes, if people say that she's an amazing doctor but she's very rude, but डॉक्टर बहुत अच्छी है, अगर लोग ऐसे बातें कर रहे हैं, so yes, person would come to me, they'll be okay if I'm being rude to them, but they would want my treatment even if I'm rude to their face. So this is how our brain plays, I mean, it's such a beautiful, wonderful thing that what it believes, what it understands, what it likes, and how it reacts to different stimuli. So and probably for somebody, if I'm being rude and they come to me, and even if people have told them, they would not stand it, they would not like it, and they would maybe say or give me a very bad review कि बेकार डॉक्टर, ऐसा कुछ डाल देंगे. So I think it's all so much of things are on perception and how we are wired, that it's really interesting.
Yeah. Okay. So next one would be like Indian myth होता है हर एक के घर पे ज़्यादा फोन मत यूज करो, दिमाग खराब हो जाएगा, ज़्यादा टीवी मत देखो, दिमाग खराब हो जाएगा तुमको. And maybe I have dealt with one of the patients like this. He was kind of a psychopath. I don't know what exactly he is. I'll not comment on it. But I have dealt with someone who just maybe because of the excessive use of phone, he was doing such game खेलेगा, ये कर रहा था, acting and etc without the phone, without the device. So have you faced anything like this, or what is this behind? इसके पीछे क्या होता है?
So there are multiple layers. There are multiple layers beneath this. पहले तो how the phone is being used, and mostly because all of us are using devices, you can't keep somebody away from the phone. But yes, what the person is consuming, at what age they are, how they are using the device is very important. if you are using your mobile or your laptops or any devices for work purpose, and you have a good schedule with it, you are not doom scrolling on phone or playing games for a very very long time each day. If your productivity, your daily functioning is getting affected because of this mobile use, you get super duper restless if you don't touch your phone for 1 hour, or can be less. If you are getting that restless, you feel that your phone is oxygen for you. So I think it's some time where you actually seek an intervention, because it can hamper your brain, because our brain works on stimulation and the kind of stimulation it is getting. And if you are using, for example, I have such patients, जो बहुत ही गलत लोगों के वीडियोस देखते हैं on YouTube. These people are mostly elders, ठीक है? And these elders, they look for these different different cures, treatments, babas and whatnot. They follow certain diets by looking at these people. It's not only about mental health, but a lot of people, doing these all fad diets, that can ruin it, and it's hampering their own opinion, their own thought. And you, like, the algorithm of these social media channels or apps is really really bad. They are trying to sell us things, and this is a whole different conspiracy. But I think that even if they are selling, it should be up to you if you want to get into that. So it's very important to be also well read, well equipped with other resources, rather than just falling prey to people on the internet. And this is one thing. The other, if there is excessive phone use, one, it is going to strain your eyes and would be difficult in long run, that if you keep doing that, you would require of course specs. But ठीक है, बाकी चीजें आपको कोई ophthalmologist बताएगा. The other thing is the excessive light that's going on in your eyes all the time. Our brain, our body works on the circadian rhythm, which is in line with the बाहर का जो, मतलब circadian rhythm ही उसको बोलते हैं, because बाहर में जो सनसेट सनराइज का साइकिल चल रहा है हमारा, उससे ही हमारी चीज भी अलाइन होती है. एंड बिकॉज वी आर सो सच इन such a beautiful place, जो बहुत ही बढ़िया टाइप का सनराइज सनसेट शेड्यूल है इंडिया में, in most regions. So it helps really well with our own biological clock thing. So it's not a place कि बहुत कुछ महीने लाइट ही नहीं रहेगी और डार्कनेस रहेगा, ऐसा कुछ भी नहीं है. You'll get sun, you'll get everything बहुत अच्छी तरीके से. So if there is excessive light going into your eyes post maybe say 6 p.m, जब सनसेट होने के बाद का जो समय होता है, and you are still having that bright light, your brain will not be producing enough amount of melatonin in your brain. It will not help you have a good deep sleep. It will lead to late onset of sleep, night awakenings where you're getting up multiple times in the night, and it will also affect your biological system, your circadian rhythm, which will ultimately, if not being addressed, और इसके ऊपर कुछ भी काम अगर करेंगे ही नहीं, तो फिर ultimately will lead to more issues. So जैसे अगर जो प्रॉब्लम्स पर ने स्टार्टिंग में डिस्कस की, इफ यू फाइंड दीज एरियाज आर गेटिंग अ प्रॉब्लम, तो वो काम करने का है उसके ऊपर. एंड यस, दिस फोन, दिस डिवाइस कैन बी गुड एंड बैड. तो ये कुछ बेसिक एस्पेक्ट हो गया कि हाउ अ फोन कैन अफेक्ट यू, योर साइकोलॉजी और योर ब्रेन. तो कई बार जैसे देयर वर सच गेम्स लाइक ब्लू व्हेल, वेयर children started to harm themselves, right? And that's a epitome of how these phones can get, or how the usage of internet can cause problem basically. तो फोन तो बेचारा बीच में आ जाता है, बट प्रॉब्लम तो इंटरनेट से आ रही है अपने को, and it can come in different devices. And phone being the easy access basically. So yeah, it can really give you a lot of problems, but the same device can help you learn so much, can help you be a professional, earn money, it can help you stay connected with your friends. तो लिमिट में करो, स्क्रीन टाइम सेट करके रखेंगे तो बढ़िया हो जाएगा. अदरवाइज देन यू विल जस्ट बिकम अ रोबोट, or you will be just part of the algorithm if you want to be so in such a cage. I mean, it ultimately becomes a cage if you, because it will keep showing you the same stuff. And वो जो है, जो reels और shorts और आए हैं अभी, which I also make, but अगर हम excessively उसको देखे जा रहे हैं बिना कुछ काम किए, so that is also leading to addiction, because dopamine बार बार वो एक्साइटमेंट हो रही है, ऑल्सो योर बॉडी इज गोइंग टू स्ट्रेस, तो कॉर्टिसोल वाला भी प्रॉब्लम होगा. अल्टीमेटली सो मेनी एरियाज आर गेटिंग अफेक्टेड. सो बैलेंस तो एग्जैक्ट हमेशा मेंटेन नहीं होगा, पर कोशिश करती रहनी है. दैट अगेन कंसिस्टेंसी, वही करते रहना है.
Basically, limits पे work करना होगा. You need to set a limit to use that. Okay, so as you mentioned, sleep. So
Yes.
sleep schedule is the one, maybe one of the reasons behind the mental health. So maybe a myth, or I have heard this in reels. Basically, reels में ही सुना है. Like you like 6 से 7 घंटे से कम नींद हुई तो like the chances of dying increases. Is it true?
See, वो तो पता नहीं वो कैसे किसने निकाल के रखा है, वो मुझे नहीं पता कैलकुलेशन. बट येस, इफ योर स्लीप इज नॉट प्रॉपर, if you are not sleeping well and you are not feeling fresh in the morning, that is one of the most early signs of mental health problem. क्योंकि नींद ही सबसे पहले गड़बड़ होगी आपकी. धीरे धीरे आपका खाना पीना गड़बड़ होगा, your diet would change, the number of times you go to the washroom, the time that you're going to the loo and all that changes, your mood changes, and बाकी आगे का होता रहेगा. But sleep, अगर नींद में प्रॉब्लम है तो that's the first indicator. तो सबसे पहले गड़बड़ होगी. भले ही आपको कोई दूसरा भी हेल्थ इशू हो, आपकी नींद ही सबसे पहले खराब होती है. अगर आपको बुखार आया, नींद खराब हो गई. अगर आपका पैर टूट गया, नींद खराब हो गई, तो नींद तो खराब होने ही वाली. सो इट्स द फर्स्ट इंडिकेटर इवन फॉर मेंटल हेल्थ इश्यूज, एंड इट इज़ वेरी इंपॉर्टेंट. कोई भी मेरे पास अगर पेशेंट आता है विद अ प्रॉब्लम ऑफ स्लीप, तो सबसे पहले आई विल टीच देम स्लीप हाइजीन, एंड वी विल वर्क ऑन गेटिंग देयर स्लीप क्वालिटी बेटर. तो पहला काम यही होता है कि भाई पहले तो अपने को नींद ठीक कर, क्योंकि नींद ठीक करने से आधे से ज़्यादा प्रॉब्लम ठीक हो जाती है. So if you are getting a good night's sleep, so you will feel fresh in the morning, you'll be better able to focus and concentrate. So sleep is very important. रही बात अगर हम कम सो रहे हैं और हमारी ज़िंदगी से समय कम हो रहा है, तो मुझे नहीं लगता वैसा कुछ है, because there are two types of sleepers. One are short sleepers, the other one are long sleepers. Basic sleep बोलते हैं कि 6 to 9 hours के बीच में होनी चाहिए, ठीक है. और पहले तो ये था 6 to 8 hours, अभी 6 to 9 hours कर दिया है. हो सकता है ये बड़े ही कम हो, बट बेसिकली द अमाउंट ऑफ टाइम you need sleep, जिसके बाद when you wake up you are feeling fresh, is the right time. A lot of times people message me or they tell me that I do sleep for so many hours, I sleep for 10 hours, 12 hours, still I don't feel fresh in the morning. That's because you're sleeping more. And if somebody is sleeping more, what is happening is there are certain brain cycles or sleep cycles that are going on when you're sleeping. तो वो एक right amount of sleep cycle complete होने चाहिए. अगर आप आधे sleep cycle के बीच में उठ जाते हो तो आपको प्रॉब्लम होगी, and that usually happens if you're sleeping longer or sleeping lesser. तो right amount of sleep cycles are important, जिससे ही आपको फ्रेश फील होगा मॉर्निंग में. तो so these are different aspects, and sleep is very important. Have a good sleep, and you can just search for sleep hygiene tips. I've also made just a basic playlist of things, adding sleep hypnosis videos. तो work on your sleep, बाकी बहुत सारी चीज़ें अच्छी हो जाएंगी.
Right. So right now let's talk about the current situation. So Gen Z's is the main thing which we
Yeah.
would talk about. So yeah, so basically the most problem is with maybe a deal with you have deal with this one. So it's relationships and breakups. To be honest, at now the breakups are the most maybe a worst case that could affect your mental health. So how have you faced some patients like that? How you deal with them? What are the measures that a person could take to take over this, move on from this things?
I think relationship issues are not just a Gen Z thing, but an overall problem because it's very, very difficult nowadays to find a partner, a loyal partner, or a partner who is, who is trustworthy, or at least the partner can also trust the other person. क्योंकि सबको ही trust issues आ गए हैं. So everybody is faking something or the other. And especially the way romantic relationships have been romanticized in books or in series or movies and all of these places, it has really hampered a lot of stuff. For example, a lot of girls would want their partners to do something very elaborate to, tell them that they like them, or for a proposal or something, so that sort of stuff. And then things are not getting fulfilled. All men would have a different feeling altogether that their partner should be able to do this, and they also have higher demands from their partners. And that has been a history that both areas कुछ ना कुछ expectation बहुत ज़्यादा रहेगी and वो fulfill नहीं हो पाती है और फिर problems आते हैं. तो सबसे पहले बात तो जब आप expectation set कर रहे हो अपने, तो there are certain things that you need to understand first about yourself and the partner. कि जैसे for example there's this thing called as love languages. There are 5 love languages, and the way it basically means that the way you express and receive love. तो हो सकता है कि किसी का सेम हो सकता है दो अलग अलग हो, और दो इंसान का अलग अलग होता है यूजुअली. So if somebody doesn't like to throw big gestures, but they like to maybe do something for them, that's called acts of service. So if this is the way that they like to express love, and the other partner wants a grand gesture or something like that, but this person doesn't feel like that's loving you, I feel that that's just wasting money. तो दूसरा वाला इंसान तो ऑफेंड हो जाएगा, यार तू मेरे पे इतना पैसे की बात कर रहा है मेरे को खुश करने के लिए. So I mean, understanding that is important. I don't say that like throwing big gestures is a wrong thing. It's absolutely fine if you like that, and I would also like it if somebody does that to me. So I think it's just जो भी हमारे expectations है, coming out very clear कि तुम्हें क्या अच्छा लगता है क्या नहीं अच्छा लगता है. Plus working on each and every individual's own problems, and accepting it that your problems are your problems and you need to work on it. No person ever can help you get over something. So अगर आप lonely बहुत feel कर रहे हो, depressed feel कर रहे हो, anxious feel कर रहे हो, and you think that your partner will resolve those things for you, that will not happen. It will only increase the problems more, because एक तो आपके पार्टनर को क्यों इतनी बड़ी रिस्पॉन्सिबिलिटी दे रहे हो जो आप खुद ही नहीं कर पा रहे हो, क्यों किसी और को दे रहे हो, राइट? किसी दूसरे इंसान को दे दो जिसका काम ही ये है करना. So it will be easier for them to help you. It will be the process will happen much quicker, and relationships would be saved in these things as well. So relationship wise, बहुत जो हम जब when we are kids or when our bodies are changing, the way we take in the way we communicate, the way we understand humans and each other really is different. And our brain is also developing. Up until the age of 25 our brain is developing. तो इतना समझो कि दिमाग तो लिटरली कम है अगर हम उससे कम एज में हैं. And there is no shame in this. That's just how our body works. So basically, even if your teenage was bad, you still have the capacity to be the person that you want to be in real life. सो अगेन कीप वर्किंग टुवर्ड्स दैट एंड यू विल गेट देयर. उसका तो कोई प्रॉब्लम ही नहीं है, मतलब वो तो दैट्स अ गिवन कि आप काम करते रहो, हो जाएगा. बट वही चीज़ है दैट यू हैव दैट. एंड ऐसा नहीं कि 25 साल के बाद कुछ भी नहीं कर सकते, उसके बाद भी कर सकते हैं. बट येस, थोड़ा और मेहनत करनी पड़ेगी, बट हम वो मेहनत तो वो भी हो जाएगी. एंड दीज रिलेशनशिप्स, वट एवर इज हैपनिंग, there is a lot of miscommunication and we can't force people to communicate better with us. तो अगर ऐसा कुछ हो रहा है that you are facing some negative thing or some bad thing in your relationship, if you're going through a breakup, it's always better to confide in a friend. Have your own support system, your own backup to talk about and to discuss your feelings, to get the support and care that you need. Because I think best friends really help out in that. But also, अगर आपका ब्रेकअप और ये जो रिलेशनशिप इश्यूज है बहुत समय से चल रहा है, so it is better that you ask for permission as well from your best friend कि भाई, do you have a bandwidth to listen to me today? तो ये भी किया जा सकता है. So you don't feel guilty of telling them and taking their time, क्योंकि ये भी होता है नहीं, I don't want to share with anybody, I don't want to be that bad energy in their life. तो ऐसा नहीं है. Share with your friend, ask them, and I think that would help. और वो काम नहीं कर रहा है तो फिर किसी और से बात करो जिसके पास एक्सपीरियंस है ऐसे चीज़ों का, उनसे बात करो. वो उससे भी नहीं हो पा रहा है तो फिर आप प्रोफेशनल के पास आ सकते हो. So you can use such help. Weirdest. So I would call this weirdest. It's a common thing that we see, and I find it very amazing or amusing, basically. So a lot of times this happens that when a person who is who's using alcohol, they would come that they want to leave alcohol. So I had this patient. He has not had any sip of alcohol for like I think 4 months now. And this person, he was on a very, very big position in a huge company, and he had to step down from his position because of his alcohol use. So what happened is, it happened during COVID. He was working from home and drinking, and then finally he had to leave the job because he wasn't able to go to the job or do the job even from home. So this person came to me and they wanted to leave alcohol because it had just ruined their personal relationships, then professionally, and he was unable to control his urge, and he knew that this is a bad habit and that he doesn't want to do it. And he wanted to genuinely leave drinking alcohol. And he could see that his health is deteriorating and everything. So he started his treatment. Now, initially, what he did is he kept drinking. He said that he used to drink 8 pegs a day. Then he was like, I'll reduce my drinks. I was like, fine, you reduce your drinks, no problem. If you can't go cold turkey, let's see how this works. And accordingly, I was adjusting his doses as well. So he was drinking, and he didn't tell me how much he's drinking, although I kept encouraging him to, try not to drink and, just try some lemon water or some soda and just don't put any alcohol in it. Just try to sip like that. But he wasn't ready yet. Then after a month, he came for a follow-up, and he was like, I haven't had a sip of alcohol since 4 days now. But what I'm doing is I'm just keeping the bottles, alcohol bottles in my house to test myself that I will not be drinking. And this is a test that I'll give. And I was like, this is just absurd. You will be drinking. It's just 4 days. Okay. Because this is what happens commonly. I mean, it's very difficult to give up alcohol because it is changing your brain chemistry, right? So, and if you don't drink alcohol, you'll start to have those withdrawals, and it's very painful, the alcohol withdrawals. There's a very, very strong urge to drink. Even if you know that it is wrong, it's impossible to stop that urge. So, psychologically, it's impossible. So, even when people get angry at alcoholics that why can't he understand, take care of his family and stop drinking. It's because it's beyond their control now, and they would need a lot of treatment to come out of it. So this person, he wasn't ready to throw his bottles, and one day he drank a lot. He went outside, met with an accident, and he broke his ribs, he broke his leg, I think, but I remember that he broke his legs, and he was hospitalized for 3 days, 3 4 days almost. And then he had to have he was on rest and everything, but still he was like, what if, because I'm so sad, I am really sad and I'm really in too much pain, so can I have one drink? He asked me this question, and I was like, can you see yourself? You have all these plasters and bandages all around you. You were admitted in a hospital because you were drunk, you met with an accident, and you still are asking me if you can drink. Mela, okay, what we'll do is this: your wife is sitting, I am sitting, and we have so much of issue and trauma in our life, and we are so worked up and stressed. What we'll do is we'll now drink. We'll go out drinking. And he was shocked. He was shocked at the fact that his wife would be drinking, and that this doctor, female doctor, is also saying that I'll also drink now, because just like you, I also have problems. So I said, your wife is also dealing with your medical bills and everything, and she's managing home and finances, so she's also stressed, so why not we should be drinking? How are we handling ourselves in this situation? So I told him this is not logical. So this illogical behavior comes because the brain chemistry is really messed up because of alcohol. Your entire body, every cell of your body is affected when you're drinking alcohol. So these are like, if you come to a de-addiction center, you would have these people telling you all absurd things to make it okay for them to drink or them to use any hard drugs. So it's not weird, but that's sadly how it happens. And they don't have that understanding or insight of what's happening and how they can help themselves. I have another case if you want to hear that. Where there was this female, who was, I think she was in her 20s, and she started to show certain signs of depression. And she used to not talk in the family. Family was like, "Theek hai, maybe she's going through something," and all that. So they didn't pay much attention. They were like, "Theek hai, you take your time and you take rest and everything." And she stopped eating, she stopped sleeping, and then she started getting very irritable, very angry, and she was absolutely, she was not eating anything. So what happened ultimately, she lost a lot of weight in a span of a week or so, because she was almost nil by stomach. And ultimately one day she got so angry, so aggressive, that she lifted her own brother up through his neck. And that was when the family members were surprised, and they were alert that now we need to do something. This is not normal. And this woman was 35 kgs, I think 35-40 kgs, and she was able to lift up a guy who was more than 80 kgs. And this was nothing but a manic episode that she had. So she was then diagnosed with bipolar disorder, and that was in mania that she did. Then there are cases where people turn steel objects, iron objects, or they would do something that they would be walking for a day straight, and they would walk 1,000 kilometers or something like that. There are such cases that have happened. So this happens in mania, when your serotonin levels are too high, your dopamine is also going absurd, and that's how we get to see such things happening. So ultimately it's how the brain is changing, and what's happening in different areas of your brain how different neurotransmitters are working. So yeah, these are interesting cases, and there are a lot more such cases that you can read about on the internet.
So lastly, ma'am, what message would you like to give to the person who just come mental health भी right नहीं है and he's going through something and जो person he is field में आना चाहता है.
Okay, so like we discussed, sleep is very important. So having a good sleep routine is important. Having a proper work-life balance is very important. A lot of youngsters, they give in themselves too much into work, thinking कि पैसा कमाना है, नाम बनाना है, पैसा कमाना है. So they don't socialize, they don't go out on vacations, they don't take time to rest. So do that. अभी नहीं करोगे तो बाद में body force करेगी आपको करने के लिए. So don't go up till to the point where your body is, it's given up on things. So learn that. अगर नहीं हो रहा है खुद से तो self-help books are wonderful. Read books and you will understand and you will be able to do it. मतलब बिल्कुल भी rocket science नहीं, आप खुद से कर सकते हो. तो वो चीज़ करो. Learn about early signs of health issues जो आपके family में already existing है. For example, if there are any hypertension है, blood diabetes है, thyroid है, कुछ और problem है, mental health issues है. Learn about the early signs, the precautions that you need to take. खुद से इंटरनेट पे सर्च मत करते बैठो, जाके डॉक्टर से बात कर लो. Be it a heart doctor, आपके पेरेंट्स जिनके पास जाते होंगे, ask that doctor, what I can do to prevent from getting these issues. So that can be done as well. तो अर्ली साइंस बहुत इम्पॉर्टेंट है. जितना जल्दी अपन चीज़ को रेक्टिफाई करेंगे या समझेंगे, उतने जल्दी और उतना कम उसका ट्रीटमेंट लेना पड़ेगा. तो फॉर एग्जाम्पल, फॉर डिप्रेशन, इफ देर आर साइंस एंड सिम्टम्स फॉर मोर देन 2 weeks to 2 months, तो आ जाओ. बहुत समय के लिए वेट मत करो, क्योंकि जितना समय रुकोगे उतना लंबा ट्रीटमेंट होगा. तो अगर आपका सिर्फ 2 हफ्ते या 2 महीने से है तो 8 हफ्ते के अंदर ट्रीटमेंट हम करेंगे. 8 हफ्ते में आपको बहुत अच्छा रिजल्ट मिल जाएगा. बाय 12th और 13th वीक आपकी दवाइयाँ कम भी हो जाएंगी. सो इट इज़ दैट क्विक. अदरवाइज अगर 6 महीने 1 साल के बाद आते हैं तो दैट ट्रीटमेंट ओनली गोज अप टू 6 months, 8 months, 1 year. तो वो चीज़ मत करो, फटाफट हो जाएगा. सो दीज आर लाइक बेसिक थिंग्स दैट वन कैन डू. Others who are, who want to come into mental health profession, I would suggest them, number 1, start your own therapy. Therapist के पास जाओ, see what a therapist does yourself. Have that experience of what is mental health. Go to the right person. Psychiatrist से ले सकते हो therapy, psychologist से, clinical psychologist, जिसके पास जाना है जाओ उनके पास, and take it for yourself. Work on yourself. You will also learn, you will also understand. Plus आपके जो भी therapist रहेंगे, they will also tell you things. If you ask them some questions about professional life, वो भी आपको guide करेंगे. And वो भी बहुत खुश होंगे बताने के लिए. मतलब मुझे तो बड़ी खुशी होती है. And I know कि बाकी मेरे साथ के जो colleagues हैं, they also get happy to share about their journey or their knowledge about whatever possibilities are there. And अभी यार इतने लोगों को stress हो रहा है ना कि it's very very important that there are enough people who are mental health professionals, because बहुत कम है. Legit वाले तो बहुत कम है. बाबा तो बहुत मिल जाते हैं, but legit वाले कम है, and it is need of the hour. It's an underlying और hidden pandemic जो चल ही रहा है already. So ऐसा नहीं कि वो आने वाला है, वो आ चुका है. When there are so many people having depression, having anxiety or other issues. So do that and सबको विजिट करो एक बार, सबसे बात करके देखो कि उनका, एंड टॉक टू पीपल हु आर डूइंग देयर प्राइवेट जॉब, इन्हें अपना प्राइवेट इसमें कर रहे हैं, बिकॉज दे वुड नो other things. People who are working in universities और corporates, उनका अलग रहेगा. तो सबसे बात करो, see what you want to do, how you want to do it. क्योंकि ऐसा नहीं कि सभी लोग काउंसलिंग करते हैं, कुछ लोग सिर्फ असेसमेंट्स करते हैं, कुछ लोग सिर्फ रिसर्च में रहते हैं, कुछ लोग पढ़ाते हैं. तो अलग अलग चीज़ें आप इसमें भी कर सकते हो. एंड नाउ पीपल वांट, मतलब कॉर्पोरेट्स में भी बहुत हायर करते हैं साइकोलॉजिस्ट को टू मेक अ बिजनेस प्लान एंड समथिंग लाइक दैट. सो बहुत अलग अलग चीज़ें आप कर सकते हो. सो गेट इन टच विद द प्रोफेशनल and understand or see what exactly you want to do, क्योंकि अलग अलग पढ़ाई करके आप अलग अलग चीज कर पाओगे, and there are a lot of opportunities, so please go ahead and do it. Come to me for help if you want.
So lastly, that was also the podcast, guys. Hope you enjoyed. So finally, ma'am, how was your experience?
Amazing. I love, as I said, we love talking about our work, everybody does. So, and I always feel good after sharing these sweet, really good things about our mental health. And thank you so much, Gaurav, for inviting me for this podcast, being very patient with me to schedule this as well. And I really had a great time. The questions were amazing. They were very interesting questions, and I hope everybody who is going to listen to this enjoys this, learns something new, and I hope they want to do or learn more about mental health. So thank you so much.
Thank you so much, ma'am, for the time. It was a pleasure talking to you. And that's all for the podcast, guys. I'll see you in another podcast. And that, have a great time and peace out.